Hey everyone, it's Russ Thornton with Wealth Care for Women. Excited today to join you for another presentation about healthcare. This time I'm joined with Clarice Michael from Caribou. Clarice and her team have become indispensable partners in helping me provide better, more personalized healthcare consulting and solutions to clients like you. Today, we are in the throes of open enrollment for Medicare. Marketplace open enrollment is just around the corner. And so whether you think of Marketplace as ACA, which is the Affordable Care Act, or even Obamacare, we're talking about the public marketplace of health plans that are available to pretty much anyone if you don't have coverage through an employer. Or even if you do, you might want to consider your options in the marketplace. So before I turn it over to Clarice, just want to thank you for joining us today and look forward to sharing this with you. So Clarice, the floor is yours.
Thank you, Russ, and I'm pleased to be here. So Marketplace 101, let's navigate the health ACA or exchanges. I think as Russ was saying as well, some people call it Obamacare exchanges, but we'll give you a guide to navigating those health plans. As introduced, my name is Clarice. I'm part of the Caribou Client Services team. Really, I'm an education enthusiast. I love the opportunity to talk and help people plan and prepare for their healthcare choices so that when you're in the throes of a healthcare event, maybe you needed to go to the doctor because you got a cold or whatever, you're not scrambling to try and figure out what plan do I have? How much is this going to cost? Can I afford it? You already know. And that's my goal, is just to kind of equip and arm you with the tools and resources you need to navigate situations smoothly without surprise bills. Everybody hates surprise financial bills. So what are we going to cover today? We're going to go over healthcare planning and the open enrollment overview. As Russ mentioned, open enrollment starts in November 1st for most states, and will run through into January. So this is the perfect window to talk about healthcare, not only just now and for next year, but planning for future years. What am I doing when I retire and I no longer have employer coverage? How long do I have to Medicare? And do I want to fill the gap, or am I going to work right up and through until I'm 65? So you can consider this both short-term, immediate, I need to pick a plan this month kind of planning, and also long-term future planning. We'll go over the marketplace basics. Let's learn the fundamentals of what the marketplace or exchanges are, how they work, and how to use the tools to your advantage. I'm going to walk you guys through some strategies and case studies as well. We can learn from the choices and experiences that other people have made and see how they navigated the marketplace to their advantage. And maybe some of those scenarios will apply to you as well. And then finally, financial benefits of reviewing during open enrollment. So how does this benefit you? What am I getting out of doing all this work and effort in relation to health insurance? And how can it change the future of my finances? So why is healthcare planning so important? There's a lot of life events that affect healthcare. So as we go through life, we might get married or have children. We may start a new job and have new options for healthcare. You could move to a completely different state or area. I know our children dependents who are 26, they're headed off to college or maybe just left. So maybe we have some empty nesters around the call who might have their college age dependents off in school now that we're in October. All of these things can change who's covered under your plan, how much it's going to cost you. The ones in the red boxes, employment changes. I'm about to retire and I'm no longer going to have employer coverage. What do I do for healthcare? Would fall perfectly into this webinar. Losing health coverage. Maybe you're on COBRA or through a former spouse or partner, you had their insurance and now you're losing that. And so if you're losing coverage, where do you go for your next steps? Exploring and changes to COBRA. Maybe you have COBRA, but it's really expensive. And you're considering, is there anything else out there that I could do instead of this COBRA? And then there's also, I have a marketplace plan already, but I'm unhappy with it. It's not working the way I need it to. The customer service wasn't up to my standard, or maybe it's too expensive. And I think I could save some by reviewing during open enrollment. So there's a lot of different life events that change your interaction with your healthcare, but we wanted to highlight the ones that are really going to bring you to healthcare planning during open enrollment. And again, you may fall into some of these categories, you may not, but there may be other reasons that are bringing you here and saying, well, what else is out there? Is the grass greener? So open enrollment is important every year because especially in the exchanges, or if you're on Medicare, even employers will have open enrollment. And quite often it's this fall season. Every now and then you'll find an open enrollment for an employer that is actually in the summertime, like June, July. But many employers do it in the fall, October, November timeframe. And that means the new plans will start on January 1st. And from January 1st onward, next year in 2024, you're going to have new deductible amounts, new out-of-pocket amounts. The monthly premium you pay may be going up. A lot of employers are increasing their premiums. The marketplace plans might be increasing premiums. So you want to always check and say, hey, how much is the increase? Can I afford that? Is there another plan that would be more affordable for me? And then prepare yourself for the January deductible reset. If you have a lot of expenses and you've, like, say you're planning on getting something done, like, oh, I'm planning on having that knee x-ray done to see if I need the surgery or not, and you've met this year's deductible, maybe you want to squeeze that in before Christmas time so that it doesn't roll over into your new deductible. So these are the type of things that you can bring up in a healthcare planning session to talk about how to utilize your healthcare to your financial benefit, to adapting to your financial plan. Provider networks change. They can change, and usually they change throughout the year. It's not explicitly for open enrollment, but open enrollment is a good time to verify that all of your doctors are in network and that you're not losing out on any coverage there. Drug formularies for your prescription medications will change, and preferred pharmacies as well. So because we talked about life events, which is where your life changes and affects your healthcare, these are industry changes. These are all things that happen in the industry that can, variables that can shift that might affect how you change your healthcare or how you utilize your healthcare. Consumers who went, and this is a quote I should say from healthcare.gov. Consumers who went on healthcare.gov and compared plans and selected the plan that best fit their financial and health needs paid 38% less per month on average than consumers who were automatically renewed. So for those of you who've never used the marketplace, when you enroll, it's going to ask you, do you want to review coverage every year, or would you like it to be on auto renewal, which means it just automatically kicks over and your plan continues year after year? That doesn't mean it's going to continue at the same price. Your premiums could still go up. Your deductible could still go up. Your insurance company, as a courtesy, should notify you. They should send you a letter and let you know that they're increasing their rates. But we're all busy. Did we get the letter? Did we put it down on the fridge? Did we forget to mention it to our husband? Did he throw it away without noticing? There's a million things that could go wrong with that letter that tells you your prices are increasing. If you set up your account to auto renew, it is very possible that you will be shifted on the conveyor belt of healthcare, and you could be paying 38% more than you need to be for the coverage that you're utilizing. So it's always good to say, no, I want to review every year, in which case healthcare.gov will directly contact you and say, you need to pick a plan for next year. It makes it a little bit more engaged, a little bit more involved. So this is an example of a caribou analysis. So one of the ways that we partner with Russ and his clients is to provide a side-by-side comparison of healthcare options. And what you're looking at is a client who, on the far right-hand side in the right column, had current healthcare coverage through an Anthem individual plan. And they were leaving this coverage and considering, do I want to take Cobra with Anthem, which would be a continuation of the plan that I'm on now, the same insurance company, the same ID card, the same doctors, medications, the same exact coverage, so nothing has to change. It's very convenient, but Cobra isn't subsidized the same way the Anthem plan was. So the Cobra would be slightly more expensive. That's the middle column. And then the third column on the far left, rather, I should say the first column, is options for new coverage. What if I didn't take Cobra? What if I took this opportunity, since I'm having a life event that's shifting me off of insurance, to look at new options on the marketplace or exchanges? And that was a Cigna Connect HSA plan bronze. So this client wanted an HSA plan. What you're going to see in the first line is the monthly premium. That's the amount the client will pay each month just to purchase this insurance plan. The out-of-pocket maximum is in the event that this client has a significant healthcare year, uses a lot of services, or maybe has like an inpatient surgery. What is the maximum out-of-pocket amount that they could pay for covered services? And we have a red box around the annual fixed costs, which is essentially that monthly premium times 12 months. That's what you pay to buy the health insurance for a whole year. And you can see it's actually cheaper than their employer plan, their Anthem individual plan on the far right-hand side, but so much more cost-effective than the COBRA. An annual savings of $4,981 and change. So when comparing that, I have a life event that's shifting me into a new healthcare situation. Do I want one option or another? This side-by-side comparison is a really clear and easy way to kind of get that information and know. Is the grass greener on the other side of the fence? There's your answer. So here at Caribou, we copy all this data anonymously, of course, but we look through open enrollment last year. So just the clients who came to Caribou and did an analysis. What were the health plan premiums that could have been saved by picking another plan? And that was $4,324 on average per person for a year. So this last example, we had a savings of $4,981, slightly higher than our average, which was $4,300. We don't worry about prescription or drug costs because those are folded into the medical care. When you buy a plan on the exchanges, your prescription medications are part of your medical coverage. But there's also a possible tax savings of $9,604. And again, this is only looking at the open enrollment window. So the opportunity to reduce risk. I talked a little bit about that number, the maximum out of pocket. In the event that someone uses a lot of healthcare and reaches their full maximum out of pocket, what's the most that they could possibly spend in a year? Well, if you compare that on one plan next to another, like we did here, the maximum out of pocket, maximum exposure on the new coverage in the first column is $12,198, and the COBRA would have been $13,130. So that would be an identified savings. Well, all of Caribou's clients found an overall identified savings of up to $13,266 for marketplace retirees. So there's a plethora of potential cost savings out there that can be turned around into your financial plan and utilized for something else. And you want to get the best care possible. Everybody wants coverage that meets their healthcare needs and gives them what they want, but nobody wants to pay more than what they have to get that coverage. So this is a good opportunity to kind of look at those. Now that we know why are we healthcare planning, why are we even bothering, let's look at the basics of marketplace. Let's talk about the foundation of getting a plan through the marketplace. What is the marketplace or the exchanges? Very simply, you guys, it's an online store for health insurance. It's like the Amazon for health insurance world. States can either use the federal system, which is healthcare.gov, or their own state-specific marketplace. And there's a few we'll talk about. All of the plans are ACA compliant, which means they adhere to the rules and regulations of the Affordable Care Act. I'm going to talk a lot about that. They're available for individuals or family groups, either one, and it's a one-stop shop. You can go to this marketplace and you can look at plans from United, Blue Cross Blue Shield, Cigna, Anthem, Aetna. All of the insurance carriers put their plans up side by side, and there's an even little compare button. So if you've ever been shopping for, I don't know, maybe like a piece of technology, a new camera or a new TV, and you want to say, well, which one has a bigger, I don't know, aperture, or which one has a stronger lens, or which one has more focus, you can click the side-by-side compare and look at 3 different cameras side by side and see which ones have the longer battery life or et cetera, more storage. The marketplace is exactly the same. You can do the same thing with your health insurance, which is a beautiful idea, is to say, hey, which health plan is going to give me more coverage for my dollars, more bang for my buck, as my dad called it. So at the top, healthcare.gov, this is the logo for the federal marketplace, which does all but 17 states. The logos underneath are the 17 states that have chosen to be individual. So Penny Marketplace here on the far right-hand side in purple is for Pennsylvania. Covered California is the first one on the left-hand side, the first column, but you also have Colorado, Idaho. There's a new one this year, Cover VA. It's in the center column at the very bottom. This is for Virginia. Virginia used to use healthcare.gov, and this year they're launching their own state-specific platform. You may ask, why would a state choose to do this? Well, one, they can brand it. Two, they can set up their own requirements. So for like New York State, they've said to health plans coming in, you have to list the plan with the following criteria, and you must list it in this specific way. We want to know which plans cover pediatric dentistry, for example, or which plans offer vision benefits. And so the states could specify how they're going to display this information and what the equally playing field would be for the companies that are selling on the marketplace. Another thing, and that's very important in, I want to say Minnesota, Be Well. No, it's not. It's not Be Well. I'm trying to find Minnesota here. Oh, Health Connector. Beg your pardon. It's in the center column. Health Connector, Minnesota. They integrate with Medicaid. So anyone who's applying to Health Connector can also get Mass Connect or Mass Health through their state-based Medicare program. Medicaid. Beg your pardon. I always can get those two words slipped. So if you're applying to one or the other, they connect and they communicate with each other and they talk. And depending on your income and your status for your family, you can seamlessly interact with either state-based health insurance or an exchanges plan. So that's some of the benefits of one of the state-run plans.
Hey,
So,
Clarice,
yes.
quick question. So I know we've been primarily talking about marketplace plans. What is the difference, or is there a difference between a marketplace plan and, let's say, private pay insurance?
Oh, very good question, Russ. Yes, actually. Marketplace plans are all ACA compliant, which means they are absolutely required to cover a minimum essential benefits to provide certain patient protections, preventative services. We'll kind of touch on this a little bit in the presentation, but they have a minimum federal requirement so that when you're shopping on one of these exchanges, you know the standard of healthcare you're getting, and it's either that or up. They can offer more benefits and extra perks to try and encourage people to enroll, but you know there's a minimum standard. When you go private pay, there can be any number of variables. So for example, a short-term plan, they can sell you a plan that's only eligible for 12 months, and then it will absolutely kick you off and it's not available for renewal. It could be less than that. It could be 6 or 9 months. You could also get a plan that was long-term. It wasn't a short-term plan, but it's a long-term private pay plan that has carved out certain benefits. So these can look very alluring and financially interesting, especially if you see an advert on the internet, or maybe you get an email and you think, wow, this plan's only $200 a month, and the other ones I'm looking at are all $400 to $500 a month. Well, the catch might be maybe they don't cover any maternity care, or maybe they don't cover mental health or substance abuse services. Maybe they don't do physical therapy past 5 visits. I will tell you, most policies, a standard physical therapy service is between 10 to 20 visits a year. This is customary in the industry, but we've noticed and seen some private pay plans that will only allow you 1 visit or 5 visits, and that's it. And then there's no coverage. By carving out some of these services, they can have their insurance be slightly more cost effective. They can be cheaper. And that can be really alluring. What you really want to do if you're buying a private direct plan, and there's nothing wrong with that, but you want to read the benefits very carefully. You want to get the full booklet, see what's covered, and specifically scan for something called exclusions. So a paragraph in every benefit booklet that will always say what is excluded. Most of the affordable care plans that you're going to find in the marketplace will exclude things like cosmetic surgery, beautification services like laser hair removal or certain skin peel treatments. These are considered more cosmetic and less medical. But if you ever get a private pay, you want to look at the exclusions and find out, are they excluding maternity care, or do they have a pre-existing condition clause? Some of them do that as well. So if you have services for treatment that was actually due to a pre-existing condition, they can deny you. So I would say private direct is a little more I don't want to say risky, but I want to say it involves more effort. You want to take more time to really look at what you're getting and really read the fine print. Whereas coming to healthcare.gov, someone else has already done the fine print for you. And so you can just trust that these plans are all of a certain standard. But that's really the major difference. That's a good question, Russ.
Got it. Thanks, Clarice.
Mm-hmm. So states with PPO plans. Now this map is a little bit out of date, and the reason why is we're approaching open enrollment. As we mentioned, it comes in November. All new plans are going to come out in the marketplace, and some states may offer PPOs that didn't have one before, and some that offered them, if not many people enrolled, they may sunset it and stop selling it. So don't take this map 100% literal. Take it more as a suggestive guideline, but not every state will offer a PPO plan, which means not every state will have nationwide coverage. Emergencies, according to the Affordable Care Act, are always covered, no matter where you are if you're traveling. But if you need routine care, so if you have two vacation homes, one permanent and one vacation home in another state, and you want to see care in both states, you need to ensure that you can have access to a PPO with nationwide coverage. This is different from most employer plans. Most companies, especially if you have a company that's maybe over 50 employees, are going to offer nationwide coverage. So it's kind of a surprise for a lot of people who retire to find out that they are limited to the borders of their state. And I will say this is particularly true for people who live in New York, New Jersey, Connecticut area. You can see if you know your map well, upper right-hand corner, New York does not have a PPO, but New Jersey does. So if you live on the border of a state, maybe on the south of Colorado leading into Texas or vice versa, New Jersey, California, Oregon, California, New Jersey, New York, any of these border places, you might find that your doctor is across state lines, even if they're only 10 miles down the road. Medical tiers. This is another important part of the marketplace. All marketplaces have arranged plans based on a bronze, silver, and gold. Sometimes we see a platinum every now and then. What I want to say is this is one of the things that I find maybe a little bit misconceiving in the marketplace, in that people generally think gold equates with better. Like if you went to the Olympics, you'd want the gold medal, not the bronze. Of course you would. So we all kind of reach for the gold. But in the marketplace, that does not change the coverage of a plan. What is covered under a bronze plan and what is covered under a gold plan is exactly identical. There's no better coverage or value. You're not getting more at the gold. It's the same value. The difference comes in the cost structure. So the more expensive the metal, like gold, the more you're going to pay in monthly premiums, but the less of a deductible or out of pocket you'll have, and the sooner your insurance is going to share cost with you. The bronze plans, you pay less of a monthly premium, but you might have a higher deductible. So bronze is great for anyone who needs minimal medical coverage. So say you are young and healthy, you're like, I don't really go to the doctor very often. I'm kind of a no-fuss person. You might pick the bronze plan and have only $100 or $150 premium, so not very expensive monthly outgoing. But then if you needed care, you could have a $5,000 to $6,000 deductible. But if you don't use any care, you've saved quite a bit. The gold plan is effective for someone who uses a lot of healthcare, who knows you're going to go to the doctor. Maybe you want to pay a higher premium that's $200 to $300 a month, so double or triple what the bronze is. But when you go to the doctor, you don't have any deductible at all, or $100 or $200. So this spreads the cost out over the year. It means you pay higher premiums. We call it a pay in advance plan. But when you have services, there's less big bills coming in. So it kind of evens the expense. The bronze plan is for someone who has a higher risk tolerance and is willing to say, I'd rather save money out of my monthly pocketbook and not spend a lot on healthcare. And then if I need the doctor, I'm willing to assume that risk of $6,000. I can pull it from my savings account, maybe my credit card. I'll come up with money if I need it. But if I don't use it, I haven't wasted money in my monthly bills. So that's kind of like the cost structure difference between the tiers. And silver, of course, is kind of right in the middle. Not too hot, not too cold, just right in the center. But the coverage is identical across the plans. And I think that's a really important kind of point to denote when you're looking at plans on the marketplace. So let's talk about the impact of that Affordable Care Act, because I've been mentioning it and hinting, call it foreshadowing, in a few places. It was signed into law in 2010, and it aimed to increase healthcare accessibility, affordability, patient protections, and it basically is responsible for massive healthcare changes industry-wide all the way across the US, and it's still going strong. So first of all, one of the major things that changed in healthcare in the US is that the only criteria they can use to determine if you're eligible for a plan is your age, your gender or sex when at the time you were born, your smoking status, and that's it. They cannot ask for pre-existing conditions. They don't care if you have diabetes or heart failure or any other major condition. They cannot deny you on that, which means everyone in America has the ability to get healthcare. And this is new. Pre-existing conditions used to be a major ability to deny coverage, and this opened up a window for so many people to have access to healthcare. Accessibility. So they wanted to create this marketplace. I told you, the one-stop shop where you can compare cameras side by side or health insurance plans, as the example goes. They want to reduce the cost of monthly premiums for plans. So they introduced a premium tax credit, which I'll talk about as well. And then in some states, Medicaid also expanded. So this was one of the tenements of the ACA, was to give healthcare to more people by expanding it and making it easier to purchase in that one-stop shop. We're going to talk about patient protections. These are the ones that everyone loves. Everyone thinks this is great. Children can stay on their plans until they're 26. I will tell you, when I turned 26, I was booted off my mom's plan and taxes at the same time. She used to file my taxes for me because she was an angel. And the year I had to file my own taxes and I had to get my own health insurance, I actually cried on my 26th birthday. Everyone else wanted to celebrate. They were like, let's go out and have a good time for your 26th birthday. And I was like, no, I have to face this now. So that's a popular one amongst many of our college-aged dependents. Insurance companies, they can't limit the amount that they're going to cover. So they can't say this is a $500,000 policy or a $100,000 policy. The coverage is unlimited. If you need the services and they're written in the plan to be covered, they are continued to be covered throughout the year. FDA-approved contraceptive methods were covered. And then there's 10 essential benefits that were provided to all patients. And this includes outpatient services. I already mentioned emergency services are covered nationwide. So if you're traveling and you have an emergency, you're guaranteed to get coverage. And you don't need to panic about if they're in network or out of network. You're covered as long as you bought one of these ACA plans. Hospitalization, pregnancy, maternity, and to newborn care, which is great. Mental health and substance abuse disorders. Prescription drugs must be covered. Rehabilitative services. And this can also be like physical therapy. So if you had a knee replacement or a hip replacement, you needed physical therapy to get back your muscle strength, that could be rehabilitative services. Laboratory services and preventative care. A lot of people ask, is my preventative care still going to be free? Can I still get my 1-year annual exam or my colonoscopy? And those will all be included as well. And then pediatric services, including oral and vision care for children, which is great. So this is the thing that Russ mentioned, if you buy a private plan, what's the difference? These 10 essential health benefits are the number one difference between a private plan and a marketplace plan. I'm not saying that your private plan isn't going to have them, but it doesn't have to. It's not required by law, and you might find that they skipped a few. Maybe they didn't want to cover any medications, so maybe you have a medical plan that doesn't do any prescriptions. So it's just really good to check. It's really good to look that over. So we'll talk about that premium tax credit. Everyone's curious, how is it going to lower the cost? And this is one of the major reasons to do financial planning and open enrollment. It's a subsidy that the government provides based on your income, your zip code, and your family size. So for example, a single person living by their own I live in New York City. So single person living in New York City, which is always very expensive here, who makes a moderate income of $50,000 is going to have a smaller, premium tax credit than a family of 4 living in New York City on the same $50,000. If you have $50,000, you're trying to feed 4 people versus 1 person, you have a bigger financial impact there. So the premium tax credit would be larger. But that's it. They just look at your income, your zip code, and your family size. And then there's different ways to claim your premium tax credit. So you can do it monthly. When you apply for a marketplace plan, you can put in your estimated income for 2024 is what we'll be looking at in open enrollment and say, what do I think I'm going to make next year? What is my usual salary or what is my incoming? They will estimate your premium tax credit over the year, divide it by 12 months, and apply it so that you actually pay that less. So let's say you're eligible for a $200 a month premium tax credit. If you buy a $1,000 health plan, you're only paying $800 a month because you're already applying your tax credit, ready to go. The other option is you're going to waive your tax credit, pay the full price, the full $1,000 a month for your family plan, but you can reconcile it when you file your taxes in the spring of 2025. You can say, last year, I had this health plan for 12 months. I was eligible for $200 a month tax credit. I would now like to take my $2,400 back in my tax rebate. And of course, you can also adjust this. So say you start the year at a $100,000 salary, you get your tax credit, and then you get a promotion, and you're now making a $110,000 salary. You can file to have it adjusted, and it will adjust your tax credit as you go along. To be eligible for premium tax credit, you must be enrolled in a marketplace plan or the exchanges, be a U.S. citizen or a legal resident in the U.S. You have to file your income tax returns. You can't be qualified for Medicaid or Medicare, and you can't be eligible for an employee plan that offers minimum essential coverage. So if you work for a company that offers those 10 essential benefits, then you could waive your employer coverage and take a marketplace plan, but you wouldn't be eligible for premium tax credit. If your company doesn't provide healthcare, you can absolutely make use of your premium tax credit. So this is one example, a family of 4 in Miami-Dade, Florida, with an income of $125,000. You can see their ages is 55, 53, a 22-year-old, and a 19-year-old. They had a very good, in green there at the bottom, premium tax credit of $1,361 per month. So that's a pretty sizable premium tax credit to reduce the plans. And given, depending on what the plans cost, between the $1,000 and $2,000 a month mark, it can really reduce your outgoing expenses. So let's talk about how do you pick the optimal coverage. So you know you want to go to the marketplace and you know you're looking for plans and you get a premium tax credit, but how do you choose? Here at Caribou, we like to ask people about your preferences because there's no one right plan. I can't say this plan is the best plan of the whole marketplace. I can say, well, for some people, this is a good plan, but for other people with different health situations and different lifestyle expectancies and different financial situations, another plan might be better. So this is an example of some preferences that we ask clients to rank in order of priority. Clients might say, all of my healthcare providers being covered is my number one priority. And a lot of people prioritize access or experience. So they might want my doctors covered. They might want a recognizable insurance carrier, someone who's name brand like United Healthcare or Blue Cross Blue Shield. Someone might want a plan that's highly rated, that has a really good rating. Other people, number 3 and 4 there, they prioritize cost. They're like, I need to save up for retirement. I have kids going into college and I'm paying double tuitions and whatever else. I want a plan that is the lowest monthly cost, the lowest outgoing each month. Or I want the plan with the lowest financial risk. I don't have a big risk tolerance. I don't like surprise health bills. If I go to the hospital, I don't want to come home to this stack of mail that's charging me money. I want a low financial risk. And then finally, some people really like their current carrier. You know, I've always been with this plan and I really love them. I want to keep this company. So based on these preferences, different plans might be optimized. And this is another example of a Caribou side-by-side plan comparison. What you're looking at are 3 plans from the marketplace. The first one is an Anthem Silver Pathway HMO plan that includes an HSA. The second option is a Rocky Mountain Health Plan, different carrier. It's with United and has a HSA as well, United Healthcare Valley Silver. And then the third plan is an Anthem Colorado option. It's a gold plan. So what we have, if you wanted to keep your current carrier for this client, for example, if they wanted I want to keep my insurance carrier, that's my number one priority, the first plan would be optimized for them. If they wanted a PPO plan because they travel a lot and they need that nationwide coverage we talked about, they might want that first plan as well. If they're not really worried about traveling or coverage abroad, they could use the HMO or the EPO, the other two plans. If they were wanting a gold plan, so I want to pay more upfront, less upfront, and have a lower, deductible, so have a lower exposure and lower financial risk, they might like that third plan, which is the gold plan. And you can see the drug deductible is only $1,600 on that plan. So it's a much lower deductible. But if cost was the biggest factor, the bottom plan in the middle, the low cost option, has the lowest annual fixed costs and the lowest maximum exposure. So both of those, the $8,497 is the premiums for the year just to purchase the plan, and that $15,000 $497 is that maximum exposure in the event that I have a big significant healthcare year. What is my financial exposure? What am I going to have to cover out of my pocket, including my premiums and my out of pocket, to meet the healthcare needs that I have? So you can see some people prioritize access to doctors and current carrier. Others might prioritize cost. And depending on where your priorities are, depends on which plan you would want to choose from this comparison. So we'll walk you through some interesting case studies, and it should take us about 5 to 10 minutes, and then we'll have time at the end for some questions. This client came to us and they wanted an HSA plan. They're still working. They have employer plans. In fact, their company offered 12 different health plan options. So there were so many plans that were available. None of them included an HSA. They wouldn't be eligible for a premium tax credit because they had access to employer coverage, but they wanted to know for a marketplace plan instead of taking my employer coverage so that I could keep my HSA, because these clients had been paying into an HSA and saving up money for a rainy day, and they really wanted to have that investment tool. So here you see a marketplace plan in Coppell, Texas, next to one of the 12 employer plans. There was 138 plans in Texas, so we reviewed 138 marketplace against 12 employer plans and actually still found a savings. The changes in annual costs, so the changes in premiums, was $2,742 cheaper to waive their employer coverage for the family and take an HSA marketplace plan at full price with no tax credit. So even though you've always just taken your employer plan, you've always been comfortable where you're at, don't discount checking out other options just in case. This is another example. This is someone who really wanted to look at the finances, the HSA and the financial aspect. Is it cheaper? And can I still invest my money? This is the opposite. I told you some people prioritize access. This person was like, I'm not really worried about the cost. What I'm worried about is the 15 doctors that I see and the list of medications on the left. And so we had 75 possible plans in Tennessee, in Knoxville, Tennessee, and we wanted to find one plan that could cover all 15 doctors, and I think there's like 9 or 10 medications there. And we did. We found one that even included a $660 monthly premium tax credit. So this is an example to say, if you're feeling like, oh, there's no plan out there that's right for me. I have very unique situation, very complex healthcare, very demanding needs or experiences, and it's impossible to find a good healthcare plan. Never say never, and we can definitely help analyze that to see if it's possible to cover everything that you want and eat the frosting on the cake too. I think this might be our second to last example. This person had a daughter. She was studying in university in another state. She was a divorcee and she was eligible for COBRA. So she could get 36 months of COBRA coverage to cover her and her daughter, but it was really expensive and she was worried about the cost of that. The bronze plan, based on her preferences, would save her $5,519 annually, which you can see in the monthly premium is circled. It was $0 because at the very top, she had a premium tax credit of $1,267 based on mom and daughter, 2 people being covered. And I didn't write that in the state this was in, but based on their income and the 2 of them being covered in their location, They had $1,200 tax credit. So we were able to find a bronze plan that cost nothing each month and saved over $5,519 a year compared to that COBRA option. And it reduced her maximum exposure risk by $4,519. So although she had a risk of $14,000, it was still less than the COBRA. The plan is a PPO plan, which is one of those great ones that allows you to travel and use insurance in different states. So both her and her daughter could have coverage in different states at the same time on the same plan. And her doctor and pharmacist were all in network as well. So it was kind of a happy ending to find that savings in one plan that covers everybody. This is our last one. Similar example. We had a woman who was on COBRA already, but it was running out. Son lived in New York and she lived in Tennessee because her son was at college. And neither New York or Tennessee offered one of those PPO plans with nationwide coverage. Neither one. So this woman was in a bit of a panic. How do I get coverage to my son in a different state when none of the plans will cover us across? So this looks at, she was in Lenore City, Tennessee, and her son was in Brooklyn. Tennessee marketplace and a New York marketplace. So now we're looking at getting two individual plans, one for the son, one for the mom, against her COBRA coverage. And with their individual incomes and their individual premium tax credit allowances, assuming that they file taxes separately at this point, we found a total savings of $9,272.64. So now I will tell you, mom secretly subsidized the plan on the back end. She sent her son a check every month to help him pay for the cost of his $457 health plan, which he wasn't expecting to cover. But even in sending her son that check each month so he could buy his health plan and covering her own medical costs in Tennessee, she was still saving money compared to the COBRA that she had been doing before with both of them on there. So whether it's finding that miracle plan that is going to cover all of your doctors, the once in a lifetime PPO that can cover you and your dependent in a different state, or whether we're looking at getting two plans to cover, there's multiple variables in the marketplace. And that's what's beautiful about it, is that you can truly individualize your situation and compile what you need to meet your needs. So with that, we'll look at next steps. Open enrollment for the federal marketplace. And remember, I told you healthcare.gov is all but 17 states. It is November 1st through January 15th. I do want to preface, even though it goes to January 15th, if you enroll before the 15th of the month, coverage will start at the 1st of the next month. So if you want to have coverage for January 1, you need to enroll by December 15th. Even though there's still an enrollment window, it's still going on. If you enroll from December 15th to January 15th, your coverage won't start till February 1st. So there is a bigger window here, but keep in mind that 2-week time processing for applications and getting the ID card out to you and everything set up. And then there's the states that have specific marketplaces at the bottom: California, Colorado, Connecticut, DC, Idaho, Kentucky, Maine, Maryland, Massachusetts, Minnesota, Nevada, New Jersey, New Mexico, Nevada. Do I have Nevada twice? No, New York. Beg your pardon. The Y just looked like a V. Pennsylvania, Rhode Island, Virginia, Vermont, and Washington. These states will have their own enrollment timeframe. It is always in the fall, but we've noticed some of them are November 15th through January 31st. Some might be October 15th through January 1. So they're shifting slightly. And there's one that's only a weird day. It starts like the 23rd of October and goes to like the 8th of January, which I thought was like a very strange. It doesn't even start in the beginning of the week. It's not even a Monday. It's like a Wednesday to a Wednesday. Either here nor there. If you're in one of these states, please check your own enrollment timeline so you don't miss that window. Or everyone can just be ready by December 15th and then no one will miss the window, which is a good strategy. Special enrollments. So outside of open enrollment, which is every fall, you can switch into the marketplace mid-year if you had a loss of coverage. That includes retirement. It includes voluntary loss of coverage. Maybe your COBRA's ending. You got a divorce. Any number of situations that can cause you to lose your coverage, whether it's elective choice, like I'm choosing to quit and lose my coverage, or whether it's a forced thing. Household changes, I mentioned divorce, but there's also marriages, dependents turning 26 and they need to do their own healthcare now, or maybe new babies arriving, moving, whether it's a whole nother state or just down the road. Moving to a different county could give you new options if your health plan doesn't cover your area. And then changes in eligibility and other qualifying events. You saw our life event slide from the beginning. There's numerous life events that can qualify a change in healthcare. These are just some of the most popular. If you have one of these events, like say you retire and you're going into the marketplace for a loss of coverage, you have 60 days before your event and 60 days after is your window to enroll. So say I was retiring December 31st and I was 2024, I'm going to be officially retired. That would be lovely, but it's not going to happen. But so I could enroll November 1st through December 31st. That's the 60 days approximately before, and all the way through February 28th, or maybe it'd be like March 2nd, which would be the 60 days after my retirement date. How a health planning analysis can help. We do financial comparison snapshots. You've seen several of them by now, and they can look at your budget, your healthcare utilization. What doctors do you see? What medications do you take? Your preferences. Do you want the access, the recognizable name brand company, the 5 stars, the access to your doctors, or would you prefer cost? Are you looking more for a cheap health plan or low financial risk? And so all of your preferences and your healthcare usages, your budgets, and more are factored in when finding plans that are optimized for each individual situation. Again, open enrollment in most states is coming up. And with that, I think we have some time for some questions.
Thanks so much, Clarice. One question I had, which I think you addressed a couple slides back, was what happens if, let's say, a person decides to drop COBRA sometime throughout the middle of the year? Does that create an opportunity for them to then go and select a marketplace plan? And I think you said that it did, whether it was voluntary or not voluntary, correct?
Yes, it does. One of the nice things about COBRA is if it's coming to the end of its natural cycle, the 18-month as usual, some people have it for 36 months, they will send you out a letter probably fairly early, like 6 to 8 weeks before the end, saying, warning, your COBRA will expire in 2 months' time. This is the end. You have no more benefits. You have to be kicked off of it now. That letter can be used to enroll in the marketplace in advance of your termination date. So if you know your COBRA is terminating on November 30th, you can enroll now, today, on October 18th, even though your coverage isn't going to start for another 6 weeks, and say, I'm looking for a plan to start in a future date. They're going to say, do you have proof of your termination? And you can say, yes, I have my COBRA letter right here, which shows the date that it's terminating. If you choose to terminate your COBRA, like you want to come off of it early, you can either do that during open enrollment or you can request a copy of that letter. You can say to your COBRA, I am canceling my policy. I'm not going to pay any more premiums for the monthly cost. Please send me my termination letter. And the same thing if you're retiring. This is a really good point. If you're retiring and you've announced to your company that you have a retirement date, you might ask them for a letter of benefit termination so that you can do the enrollment early. Good question.
Got it. Thank you. I don't think I have any other questions. A couple of other things that had come to mind were about the fact that there are no premium tax credits or subsidies with private pay plans, which you highlighted. So I think you covered all the bases. Is there anything that you've been dealing with this far longer than I have as far as health planning goes? And you and I were chatting before we started the actual presentation about the crazy level of activity that you and your team are dealing with right now as we're in open enrollment for Medicare. Is there anything that I didn't ask or that you think would be good to highlight for folks as we wrap up the presentation today?
Yeah, I think the premium tax credits is the hot topic everyone wants to know about. What can I qualify? How much am I going to be one of those people with a free plan? And what I will say is the tax status is everything. So how you file your taxes, and it is reconciled. So if you are married but filing separate taxes, you need to apply individually. You can still get a household plan, but you each file your own income in the application. If you're filing jointly, that it calculates the household taxes. And then dependents, there's that point where it's like they're off at college. Are they listed as tax dependents on your tax return, in which case you're counting them in your healthcare plan and in your overall tax premium? Or in the one case, I had that student who was in New York and his mom was in Tennessee. He actually qualified for a better premium tax credit on his own income because he was working at a restaurant, I think. And so maybe having them file their own taxes at that point and get their own premium tax credit for their plan, and you have your own individual tax credit. All of these things can shift. And so what I would say is in domestic partnerships as well, if you're residing together but not legally married, that has a whole different complexity to it. So these are all situations that we want to look at individually, that you want to say, okay, specific to my family, my income, and my zip code and my situation, what is that tax credit? And be prepared to file changes if your income goes up or down. Again, you can always reconcile when you file your taxes, but if you don't want to face a tax bill in the springtime, you can change it on healthcare.gov. You can log in at any time and say, hey, notified, my salary jumped or dropped. And that's one of the most important things that I think I see. The other major thing is just trying to sort out. I mean, some of those case studies you saw that we had 75 plans in Texas, and there was another one that was like 125 plans. There's so many options out there. Don't let yourself get overwhelmed trying to look through all of them and compare, which camera on Amazon is better than another camera. It can be very stressful. Stop and think about, what are my priorities? What are my healthcare needs, my doctors and medications? And then whittle it down to the plans that cover those needs. That'll half the list easy. And then based on the ones that cover their needs, do I want a more recognizable company? Do I want a lower financial cost or lower risk? Do I like risk tolerance? Am I a gambler, or am I more like, I want to play it safe? And really start to self-reflect. I think self-reflection is the best way to find the plan that is going to be uniquely suited to you. And so that would be maybe the second piece of advice that I think comes up a lot in open enrollment is, how much money can I get, and how do I pick from the sea of options? But thank you for asking, Russ. Those are also good questions.
No, well, thanks for sharing. I think those are certainly important, and maybe a good place to sort of begin to land the plane on this one. So, Clarice, thank you. Your passion and knowledge around these topics and just the excitement you bring to educating folks shines through, and I appreciate that. And I know anybody else watching this will as well. For anyone that is watching, if you know me or you're a client and you would like to discuss or review your health coverage, or you're going through one of many life changes that were on one of those earlier slides that Clara shared, feel welcome to reach out. I would be happy to have that conversation with you. As you can imagine, your health care and its related costs play an increasingly important role in your financial plan. If you're not a client but would like to discuss your health coverage and its role in your personal financial planning, please reach out and let me know. And with that, Clarice, thank you again. Thank you to everyone at the Caribou team. Really enjoy working with you guys to help me deliver better advice to my clients. And thanks everyone for tuning into this one. We'll look forward to catching up with you again next time.
Absolutely. Always a pleasure, Russ. Thank you.
Thank you.